Hello everybody, Ron here from JawHacks. I'm grateful for the opportunity. It's good to be here with you all. This is my second Mewing event, and I'm excited to be able to be part of a great panel with such amazing presenters. So let me begin with this. So I first want to just pay tribute to the late Dr. John Mew, who I have the utmost respect for, and I think that my interviews with him, I will look back on 50 years from now, God willing, if I'm still alive, and there'll be a little time capsule of a time when I was able to reach a prior generation and a visionary from a prior century. A lot of what you see here about what Dr. Mew is saying about jaw surgery, don't even think about jaw surgery, a sentiment that he expressed in my most recent interview with him, is sort of relevant to the talk that I'm going to give, which is about what can we do if mewing is not enough. Now, I'm not a doctor or a dentist or a healthcare provider of any kind. I'm, like James Nestor said earlier, I'm just a conduit. I'm a journalist, essentially, who interviews doctors and dentists such as Dr. Mew and such as, maxillofacial surgeons and orthodontists who provide skeletal treatment for, hypoplastic conditions, basically underdeveloped jaws, in people who want to fix that. So what I'm going to talk about today is what you can do if mewing is not enough, and if tooth-borne expansion is not enough, a la Dr. Hang's presentation. And by the way, I don't know if Dr. Hang realizes this, but Dr. Hang was actually my first consult when I went on my own treatment journey back in 2014, and I was living in California at the time, and I took several buses and trains up to see Dr. Hang at his office, and him and his wife were very kind and gracious to me, so I just want to say thank you to Dr. Hang for that. But what I'm going to be talking about today is skeletal expansion, MARPE and jaw surgery. So here I am showing Dr. John Mew, the FME, which is the cutting edge of MARPE skeletal expanders today, and till the very end, actually just a few weeks before he passed, Dr. John Mew was emailing responses to my Substack posts about MARPE, saying that he doesn't like MARPE, he doesn't believe in it, he thinks it's too aggressive, and that he thought the BioBlock was better even for adults, which, even though I disagree with Dr. Mew on that, it's something that we respectfully disagreed on, and I think it's important to be able to disagree and still remain civil and friendly, which is something that's lacking in discourse today. So moving on, MARPE can be great as long as you avoid some of the big problems that go along with MARPE. And those problems are asymmetry, overexpansion, dental flaring as a result of the appliance transferring force into the teeth. And so just as a background, for anyone who doesn't know what MARPE is, we're actually looking at a MARPE here. This is called the FME, the Facegenics Midfacial Expander. And it's an appliance that gets screwed into the roof of the mouth on either side of the mid-palatal suture, and then there's a jack screw here that you turn, and normally the suture is pre-cut with a piezo knife to release the suture so that the expansion goes quickly and smoothly, and this occurred in this patient as well. But essentially, this appliance spreads the mid-palatal suture and ideally the entire mid-face in the transverse direction. And that is what we call a MARPE, or a skeletal expander. Sometimes online it's referred to as MSE, even though MSE is just a brand of MARPE. And there's many brands, right? This is just one brand. In my opinion, it's the best brand, although maybe not the best for every patient. This is called the Facegenics Midfacial Expander. And let me show you what these types of skeletal expanders and what this specific device in this patient's mouth did. So here we're looking at a GIF of a superimposition of the post and pre-CBCT, courtesy of Shuikai. Shuikai is a very active member in the jaw hacking space. He's on the UARS new subreddit and on a Discord that he runs. And he did all of the superimpositions that I'm going to show you of this Facegenics Midfacial Expander. So you can see, I'll call your attention to several areas, but it's really incredible. Look at the nasal walls, right? So when we talk about tooth-anchored versus skeletal expansion, here is a big place where they differ. Sure, you can get a lot of intermolar width increase with with tooth-anchored expanders. But what you don't get is expansion up the walls of the nose like what you see here, or expansion of the zygomas like what you see here, that nice aesthetic midfacial projection and angulation that forms when you expand the entire midface. You don't get that with dental expanders. And, you additionally also definitely get the mid-palatal expansion too, for the additional tongue space for facilitation of mewing. I mean, the expansion here is going all the way up to the eyes, which is quite incredible. And another thing that happens with these MARPE devices is that the palate not only expands in the transverse, but the palate actually comes forward to some degree and actually drops. But this can also be very good for someone who has a slightly recessed mandible. It doesn't actually expand the mandible, but it gives the mandible a chance to reposture in the joint in the forward position. And of course, there's limits as to how much of that can occur safely and healthily, and it's patient-specific. Not every patient's joint can accommodate this reposturing, but for this patient, being able to slide his lower jaw forward without going into a class 3 malocclusion, which is an underbite from having to tuck his lower jaw out in front of his upper teeth, has been very comfortable and therapeutic, and has been quite a relief on his pharyngeal airway. And all of this just with that skeletal expander that we saw back here. This was, by the way, roughly an 8 or 9 millimeter expansion, which is a pretty bold expansion. And we can talk about what he's going to do for the mandible later. But for now, let's just focus on the effects that this thing had. And in this image, we can see actual skeletal change at the A point of the maxilla. So the white part in this scan is the pre-maxilla, and not the premaxilla as in the anatomical location, but the maxilla in the pre-treatment scan. And then the green image here, which is overlaid, is the maxilla post-treatment. Everything else is superimposed to be in alignment by Shuikai, the gentleman I mentioned to you earlier. And you can see a real advancement just from this MARPE of, you could say, several millimeters. And if we look here, we can't read too much into this video, but this video gives you a hint as to what's going on with the pharyngeal airway. Now, his neck posture did change in the CBCT images, so we can't say necessarily that this MARPE accounted for this massive pharyngeal airway change. I'm mostly just encouraging you to look at the change in the bone here, and not so much the airway, because we don't want to make the mistake of reading too much into that slice of the pharyngeal airway. So obviously, and here's some images of what this has done to the inside of this patient's nose. I mean, look at this. Look at the walls of the nose. So many patients present with poor nasal breathing. It's the central pain point of the condition that we sometimes call UARS, upper airway resistance syndrome. Even if these patients have double jaw surgery, they might still complain about poor nasal breathing and potentially then come seeking these MARPE treatments after in order to get this exact effect that you see here. Okay, an expansion of the nose on the inside going all the way up the y-axis toward the eyes, and then down the z-axis as well, deep into the skull. So it's a remarkable change in the nasal airway. We can see a little bit more of that here. This image actually shows more of the advancement effect that occurred with the appliance, which people don't realize that these MARPEs, in addition to being transverse expanders, generate quite a bit of advancement of the palate too, if the expansion is significant enough. And here you can see a little bit of the soft tissue effect that this treatment has had. And you can see, I'll call your attention to the lip area. Things are coming forward. And obviously in the zygoma area, the midface is becoming much, much more prominent. Here's the before, there's the after. I mean, look at the cheekbones. So before I move on to jaw surgery, I just want to talk about what can go wrong with these MARPE expanders and where we're at today. And that discussion brings us back to why I'm talking about the FME. So these MARPE expanders are not all upside. They can have a tremendous downside. And that is if they go wrong. I mean, these things are extremely powerful, and they change your face, as we have seen, not just in your mouth, but they change your face going all the way up to your eyes. So if the treatment isn't, and this is probably the biggest problem that we've seen with these MARPE expanders over the past few years, if the expansion isn't symmetric, then it can be catastrophic for the patient. And it can cause asymmetries in the face, going all the way up the midface to the eyes, which can be very unaesthetic. And so where are we at now with solving that problem? Well, this FME device has much more careful cephalometric planning that goes into it. And what do I mean by that? I mean that part of what you're getting with one of these newer expanders, such as this FME device and maybe some carefully planned custom MARPEs, which is another leading brand, the Partners Dental Studio Custom MARPE, there's a lot more consideration going into how are we placing this device into the patient's palate? How are we orienting it so that when the expansion screw inevitably goes left-right, that it's going to produce an expansion pattern that is straight and symmetric and that doesn't cause things to go too much one way or too much the other or too much forward and one side back, which are, some of or potentially even having one side drop and one side not drop, which causes a horrible maxillary canting problem. The way this is solved is careful planning of the placement of the appliance, and then as well, compared to an MSE Type 2, which is the type of expander that I had in 2019, this is a much more robust appliance that has more what we call dimensional stability, which means that if during the expansion process, the skull itself starts to try to reorient the appliance. Let's say the appliance has been oriented in a straight, symmetric fashion, but then the resistance forces of the skull try to bend the appliance out of position. What this appliance will do, because it's so big and robust and has these guide barrels, it'll just lock up. So if it's turning, it means it's still straight. It means it's still in the exact position that the doctor planned for it to be in. And if it stops turning, that means that something has gone awry and that there's twisting forces that are occurring in the skull, and the appliance will not let you expand in a twisted fashion. So this appliance solves one of the big problems we've seen with MARPE, which is asymmetry. And I shouldn't say that it solves it, okay? Because although we've seen about 100 cases of FME come out and most of them have been great, we're by no means at the end of progress when it comes to development of these appliances. And, I don't want to declare that we've arrived at the promised land or anything like that. This is just where current state of the market, September 2025. Another problem that this FME device solves is the dental effect that MARPEs have had in the past. A lot of the custom MARPEs and the MSEs had arms that went out and connected to the teeth. And that can be great for providing strength to the appliance because essentially the teeth are like another temporary anchorage device. They're like another screw that provides strength to the appliance in its effort to split the mid-palatal suture. The FME attempts to be robust enough to not need dental anchorage. So you know that any expansion that you're getting, and we can actually see this in the scans, we know that we're essentially getting zero dental impact on from this appliance, which is great. Any change that's happening, of course, except for the teeth that are here at the diastema point, because as the bone splits and these teeth spread apart, it's actually a little bit questionable how good this actually is for the periodontal health of the teeth in this area, but that's kind of a nuanced point. But in terms of the spreading transverse force, it's all in the bone. None of it is in the teeth, which is great. Let me skip ahead here to the next thing I want to talk about, which is another thing that you can do if mewing is not enough, and that's jaw surgery. And Dr. Hang talked a little bit about that. Here is an example of a pre-op image of a patient, and here's this patient's jaw surgery. You can see that, the MARPE was more of a left-right transverse expander, although we did see that it did have a little bit of an anteriorizing effect on the palate. But what we're seeing here is a real significant advancement of the maxilla, a complete reangulation of the maxilla. Obviously, MARPE has no control over angling whereas double jaw surgery has full control, and you can see a massive, massive mandibular expansion, which is obviously something MARPE doesn't do. Any effect that we saw on the mandible from the FME case we looked at was just a reposturing of the mandible forward. It was not actually, there was no lengthening of the mandible like we see here with this BSSO cut that's part of this double jaw surgery. So I've basically said you can, when mewing isn't enough, you can do MARPE, you can do jaw surgery, or, and this is my last point, you can do MARPE and jaw surgery. And why would you want to do that? Well, with jaw surgery, it's true, you can actually get expansion during jaw surgery. And here's an example of how Michael Gunson does expansion with a multi-piece upper jaw surgery called a segmental Lafort. And yeah, you can get some palatal intermolar width increase and increased tongue space, and you can expand the floor of the nose, which can be good for nasal breathing. And you can do it differentially, which means you can expand one side more than the other in case you have a patient that needs, differential expansion. That's definitely not something MARPE can do. And you can do it all without having to do a multi-year orthodontic process or risk any of the side effects, the negative side effects such as asymmetry that can come along with a MARPE. But what I've been seeing, and where do I get my data from? I should clarify. So what I do is I provide patient advocacy consulting services. So patients that are considering undergoing expanders and jaw surgery might talk to me about current state of the market, who are the top doctors that I'm seeing my clients get the best results from. And so I'm constantly getting this real-time feedback from people that are out in the field getting these treatments and getting consultations for these treatments. And what they're telling me, and what I've been seeing more and more of, is patients that have had jaw surgery but still suffer from poor nasal breathing. So you can imagine spending $50,000 to $100,000 after logistics and travel and lodging, $50,000 to $100,000 on a jaw surgery to advance your jaws, and then still coming out of that process after a brutal recovery, potentially permanent nerve damage, not being able to eat solid foods for weeks, being swollen like a balloon for weeks, recovering from all that, and then still feeling like you have a stuffy nose and that you have this tendency to mouth breathe. And that I've seen be an extremely frustrating thing for patients. And now they have to consider additional treatment, which is one of these MARPE devices, to get that expansion after surgery, which is a horrible, horrible place to be in. Because you can imagine if you've had your palate diced up like this, and then you put one of these expanders in, these expanders will break at the weakest point in your skull. So hopefully that's a pre-cut mid-palatal suture, which is ideally where you want to expand. But if you've had all these cuts done surgically, or even just a few of these, this is a relatively complicated segmental, and they're often simpler than this. But any amount of cutting that you've had on your jaw, whether it's the regular Lafort cuts or whether it's the segments that are in the palate, that's going to tremendously complicate your ability to do a MARPE later, although people are doing it with very mixed results. It's risky and prone to failure, but people are doing it. And so my general sentiment is there's something that MARPE can do that jaw surgery can't. And it's this. I showed it to you earlier. When you do a jaw surgery, you're cutting here. This isn't very precise, but you're cutting essentially lower down in the face than up here. And the vector of the expansion that occurs with your jaw surgery, even if it's a segmental where you expand and advance at the same time, it ends where the Lafort cut occurs. And so you're not getting any expansion of the superior part of the nose. The expansion stops at the height of the Lafort cut. And so the MARPE, as we see in this image, can expand all the way up the nose, which has the potential to provide tremendous nasal breathing benefits. And so where I'm kind of at, and this is subject to change as I gather more data over the next year and beyond, where I'm kind of at with it is, if you're a patient that has distinctly poor nasal breathing and you're a candidate for jaw surgery, you may want to consider doing MARPE first in order to cover your bases when it comes to nasal breathing, and then do the jaw surgery after to solve the soft palatal and pharyngeal airway issues. Because if there were a time to do MARPE, it's definitely before jaw surgery, because as we've seen after jaw surgery, trying to put in one of these Newtonian expanders that are just going to break at the weakest point, it's very risky and it's much more difficult to do. And even if you don't go crazy with expansion, and you never should, and you could even argue that this expansion is excessive, because there's question marks here about how the mandible is going to be brought back into occlusion, although it's probably possible. Even if it's just a moderate expansion of, let's say, 4 to 5 millimeters, and this is 8 or 9, like I said, a lot of the nasal breathing benefits you get from MARPE happen early on in the process, and it's not linear, which is to say, even a little bit of expansion can result in an exponential amount of nasal breathing improvement. And so I'll conclude with that thought, that any patient considering these treatments that presents with distinctly poor nasal breathing ought to consider the MARPE before the jaw surgery. And that is the end of my talk for now. Thank you all.